Hello, good afternoon or good morning, wherever you may be. Welcome to Module 16, using data for decision making and planning for learning continuity. Again, I'm Doc Ivy Cloma Rosales from PSPHP, and this is the fourth the of part 4 and also the last module for this course. So in advance, I'm going to say congratulations. In this last module, let us synthesize what we have learned in the past few weeks. How exactly do we implement evidence-based interventions and applied data analysis for our daily decision-making in the context of resumption of face-to-face classes? So these are our learning objectives for this module. In a sense, we are bringing it all together. So first, we'll tackle biology, wherein we want to understand the following principles to decrease transmission of COVID-19 and similar diseases: hierarchy of controls, vaccination, and overall health of children. Then BITES, which is basically school health surveillance, which is what we've been talking about in modules 13, 14, and 15. We'll review that. And behaviors. Appreciate examples how healthy behaviors can be supported within schools from real-world examples. First, let's take a look at the key school reopening policies. These are the most important ones. So first, you had the JMC 2021-01, which was the joint memorandum circular of DOH and DepEd on the implementation of limited face-to-face learning modality, right? Shortly after that, DepEd then released DM 068 2021, which is basically additional guidelines for your WASH program. WASH meaning water, sanitation, and hygiene. That also sometimes also called WINS. Then after that, you also had DM 071 2021, which is the preparations for the pilot face-to-face expand transitioning to the new normal. A lot of these DepEd policies follow the frameworks also given by UNESCO, World Bank, World Food Program, and WHO there. So these are the key school reopening policies as of this recording. And I just enumerated here some related DepEd school health policies from, well, that's 2018, 2020, 2021. So here, I'm sure you're familiar, if not very familiar, with these school health policies. So that said, let's look at the overall program of school reopening in the Philippines. So relating it to the health system, so I know you have a school system and you have the health system, right? So macro level, which is really national level. So that's really under both the Department of Health and DepEd, and they give out the national guidance for school reopening and the policies on what interventions are needed. But usually when they give this guidelines, it's really quite high level and quite flexible also. So it's really up to you later on how you will implement it in practice, right? So that's macro. And then you have meso, which is very important. That's really the municipalities, the local government units, your local DepEd. So which all of these offices should be collaborating for epidemiological surveillance, ensuring schools follow the national and local guidelines, and making sure that the schools in your specific area are ready. And then there's micro level, the school level, which is really assessing and ensuring feasibility and compliance, having supplies, training systems in place, promoting and implementing those programs, and communicating with students, teachers, and parents. So that's really your role as a school in the micro level in school reopening. So the JMC itself says that there is no one size fits all when it comes to school reopening. The JMC, the Philippine JMC. But even in other countries, there's no perfect way of doing it. In practice, school reopening is really responsive and dynamic. One example here is a US example wherein the different cities or districts or states had different requirements. In fact, they differed a lot in terms of wearing of masks and whether they were going to go remote or or virtual or face to face. And the way they implemented also, it really changed over time. So yeah, so even in other countries, it's not perfect, or there's no one rigid protocol to do it. And we will see different countries' examples throughout this module, this lecture. Okay, so let's go back. We mentioned 3 Bs, which is biology, bites, and behavior. So biology, and there are 3 things that I want to emphasize here. It's the hierarchy of controls, vaccination, and over health and well-being. So these are your strategies to address the control, to be able to control COVID-19 and other similar diseases in a school setting. So let's look at the first one, which is hierarchy of controls. So, okay, this is it's a classic public health principle. It's called the hierarchy of controls. As you can see, it is an inverted triangle. The top being the most effective of controls and the bottom being the least effective, but still effective. Okay, it's just that it's on a smaller scale. So